Well, every year, the 24th of March is observed as World TB Day to amplify the urgency of ending tuberculosis, the world's deadliest infectious disease. TB continues to devastate millions globally, inflicting severe health, social and economic consequences. This year's theme is, Yes, we can end TB. Commit, invest, deliver. It offers an opportunity to reflect on ongoing efforts and encourage stronger commitment at local, national and international levels to end TB, including by combating the growing threat of drug-resistant TB. To help us understand TB better, we're going to be joined shortly by Dr Jean-Louis Abena, who is a technical officer for tuberculosis at the World Health Organizational Regional Office for Africa. But who we have on the line with us at the moment is a TB survivor, Busisiwe Beko. Busisiwe, thank you. Thank you very, very much for joining us here on the program.
Thank you, Leanne.
So, Busisiwe, we call you a TB survivor. Talk to us about your journey and, you know, the circumstances around you getting TB and what it was like living with it.
Leanne, I was pregnant when I was diagnosed with TB. I felt scared, thought I was going to die. I felt bad, guilty, and I had self-stigma. I was terrified, especially when they told me in the clinic that my close contacts were also at risk. It does not get any closer than sharing the same body after all. And although I was coughing and losing weight, I was afraid for what might happen to my child, which preoccupied me most of all. How will the TB affect her? Will she got it too? Will the tablets that I was taking to try save my life and end up hurting hers? Although there are 10 million people sick with TB every year, and thus I certainly was not the first or only woman trying to figure out how to manage the two very different passengers, whom one badly wanted the other most, with whom I was sharing my physical form. I found out nobody in the clinic could answer my questions for me. Fragmented into adult and pediatric world as TB services are, there was nowhere I could turn. My daughter was unfortunately diagnosed with the TB when she was 5 months old, and things becomes more difficult.
Yeah. In terms of your daughter, let's perhaps talk about her and, you know, what happened when she was also diagnosed with this.
For her, because she was still like an infant at that time. So for me to get care for her and me was a struggle. With long queues sent from pillar to post, even when we finally saw the health staff, they were not equipped to deal with her as a child, me as a mother, and us as a family. The tablets that she had to take did not come in a child-friendly version. They were so painful to swallow. I found them nearly impossible to prepare. How to measure really a quarter of the tablet and give it to the child.
Yeah.
And I feared I was likely to underdose or overdose her. I felt I was like set up to fail. Not I did have my own health needs, but I also had to look after her needs. There were side effects of the medication, such as nausea and vomiting. The challenges of going to the clinic every day. Services not integrated, different days of appointments and different healthcare facilities with different healthcare providers.
Yeah. I mean, it's almost impossible to understand what you went through. I mean, a 5-month-old baby, and you have to administer tablets, and you are given this treatment that you have to medicate your child and get your child through this. May I ask you, how is your child? And I mean, how did you get through this?
So with true support, like from the friends and some of the community members and extended family members, I did manage to get through.
Thank goodness. And your daughter's okay?
She's fine. She's doing well.
That is amazing. Well, I'm glad that this is a good story with a happy ending. But tell me, how do you feel? I mean, are there after effects of having TB and your daughter as well? How old is your daughter now, by the way?
She's doing fine, and she was just like a long run, like diagnosed with asthma. But to be honest, she's doing well. She's fine now. She's a big girl.
And how old is she, if I may ask?
She's 18 now.
18. Okay. So hopefully things have changed. And this is where I'm grateful that we're now joined by our next guest, Dr. Abena. And Dr. Abena is, Dr. Jean-Louis Abena is a technical officer for tuberculosis at the World Health Organization. Doctor, I'm glad we could hopefully get your connection better now. I mean, we were listening to Busisiwe's story of being diagnosed with TB while she was pregnant and her child also getting TB, and she had to treat her child, but by administering tablets to a 5-month-old baby. Talk to us. This was 18 years ago. Doctor, have we evolved now in the treatment of TB in Africa?
Yes, we have evolved in the treatment of TB, especially dealing with infants. So there are new formulations of TB medicine that are children-friendly, that are available. So in Africa, we made a lot of progress. We just adopt all those new innovations in terms of treatment. We have shorter treatment, especially for MDR TB that are very common in South Africa. So now the treatment is 6 months, and we are coming from 24-month length of treatment, so with a lot of high mortality. Now the cure rates are better, and the medicine are really few, and they are also with a less side effect. These are the progress. And also for the diagnostic, we have a modern platform for TB diagnostic, especially in South Africa and all over the region. We are diagnosing TB with a more modern equipment that is called a molecular diagnostic. So this is the innovation that we can talk about when we listen to the story of our young sister, the story of a family with TB, pregnancy with TB, and this is the progress we can share with the patients. So we have better diagnostic, better tolerated medicine that are available, and we hope to have a better outcome. And this is what we see, and there is a lot of progress in the TB response in the region. These are the progress that we can share with the patient.
Yeah, which is, it's good news. I mean, thank goodness, this is very good news. But obviously there's significant challenges in diagnosing TB in Africa, because we've been putting up the symptoms on the screen, but when you sort of have very far-flung areas and people are not sure what they've got and actually getting diagnosed, this is probably a very big challenge. Talk to us about that.
Yes, the diagnosing TB is not a straightforward issue for a medical doctor. We need to think about TB when we see any patient, and because of the high rate of incidence of TB in certain countries, I want to cite again South Africa, every person getting in the hospital should be screened for TB, and we can screen with the common symptom: loss of weight, sweating, loss of appetite. These are these general symptoms, and also cough. So we don't rely on the cough, because patients tend to decrease the significance of the cough. And these are the technical challenge we are facing in our hospitals. So our TB patients, they come to the hospital, but they are not identified as such. This can be one part of the problem. We have also the population that does not have access to the health facility, because it's out of the pocket expenses before being identified as a TB patient. So they are facing hardship, on the financial hardship, when they are they go to the clinic. This is one major obstacle. And we don't also have, in terms of health system in the clinics, the adoption of new technology like X-ray. This is ancient technology with AI, and we really need to have this technology available for the patient.
Yeah.
So these are the challenges. So we have challenges from the patient, we have challenges for the health system, and the HIV is also contributing, epidemic is also contributing to the difficulty of diagnosing TB, because TB can go to all the other
Okay, we seem to have just lost the doctor's sound, but I think we got a good indication there. Busisiwe, I want to come to you now, and the doctor touched on a very important issue, and that, of course, is the finances, because I imagine that for you, even though this was a couple of years ago, but the financial challenges must have been very difficult for you, treating both yourself and your daughter. Perhaps you want to talk about that?
Yes, Leanne, even today, as the doctor has mentioned, people with TB face substantial cost and income loss while navigating the care pathway. It could be direct or non-medical costs, like indirect non-medical costs before and during treatment, and also not leaving behind food insecurities. Yes, there are social support, but there are barriers to access those social support. For me, in my case, I have to stop working. Yes, I could say like I was living with God's grace.
Now, however, I mean, obviously, this is many years later. Have you got lasting symptoms? I mean, has it impacted your health dramatically, or did the treatment help you that you've managed to lead now a perfectly healthy life?
Yes, Leanne, anyone can get TB. I could start from there. TB is curable.
Yeah.
Me, myself, I'm cured with TB. TB is preventable. Things have much improved, as the doctor has mentioned. As some people don't show TB symptoms, the department, yes, now is prioritizing that everyone get tested, especially people living with HIV, the close contacts of TB patients, such as like we're staying together or we're working together, we're driving together to work, and people who had TB before, like me. There is an effective and shorter treatment regimen, yes. There is life after TB.
Yeah.
But remember, TB can lead to death if not treated.
Yeah, and that's the reality. So we've lost the doctor again, and I'm so sad about that, because I really wanted to quiz him more, because there's just so much to talk about, especially the challenges that we are potentially going to have as a country with the lack of funding. I mean, we saw over the weekend that there have been cancellation letters which have ended now billions of rands of South African universities, US government-funded HIV and TB research grants with immediate effect, and this is a big problem, and I know the World Health Organization is going through its own issues when it comes to funding. But perhaps just to get the final word to you in terms of how we as a community can better support TB survivors and those that are undergoing treatment, and just those that may be going through it all right now. What is your message to them?
Yeah, I would lament to say, like, there must be more focus on protecting pregnant and lactating people, and also adolescents. We normally forget about that group. Through research, not protecting them from research. We have to recognize and appreciate and embrace that communities are experts of their care. Also, we have to involve TB survivors in design, implementation and execution of research and public health activities through community engagement and multi-sectoral action team, not forgetting clinic committees to keep Department of Health accountable for quality services. There must be during treatment and post-treatment quality counseling. And also, I will end by saying, when the life of individual with TB patient improves, the community around them improves, Leanne.
Yeah, indeed, it does. Thank you. I think great words to end off this conversation on World Tuberculosis Day. Of course, 24th of March is observed as World TB Day. And talking to us, and so eloquently, we were joined by Busisiwe Beko, who is a TB survivor, her daughter as well, having been diagnosed with TB, and both of them now leading good, healthy lives after getting the correct medication. It wasn't an easy journey, but something that they're here to talk to others about. Unfortunately, losing Dr. Jean-Louis Abena during the conversation. He, of course, is the Technical Officer for Tuberculosis at the World Health Organization's Regional Office for Africa.